When I went in and discovered through my ophthalmologist that I had macular degeneration, I was horrified.
I had no idea that I had macular degeneration, but I did know what it was. I did have friends that had it, and I didn't want it.
I was aware that my mother had it. My sister had it. I knew one of the symptoms was the wavy lines on a vertical or horizontal surface. So I knew it was my right eye that had this macular degeneration.
I was not really happy about the diagnosis because eyesight's everything.
Total whammy, almost like somebody telling me I had cancer.
I would probably not be driving for very many years longer. To be able to have this treatment and see an almost immediate turnaround was so encouraging.
I went to Dr. Luttrell, and he's saving our eyesight. And that's the most important thing that you can do for somebody.
The way I describe it to others is that the laser helps to give the cells that are failing a kick in the butt to get their acting gear and to work harder.
I've had a lot of medical treatments, and this one's about as harmless and about as painless as I've had.
And that's the beauty of it. It takes about, 4 minutes, and then I come back in a few days and do the other eye, and then I'm done for 3 months, and I'm happy because I can see a little bit better.
I know I'm ahead of the game. That makes me feel good. The people that I'm aware of that have the wet, their vision is much worse than mine is today. I really feel the laser is what's prolonging my vision in my right eye.
It was like a miracle. The treatment helped so much with me being able to see more clearly and also to be able to continue driving.
There's an old saying, the best way to ruin today is to worry about tomorrow. And I don't want to worry about tomorrow. I want to feel like today I'm doing what's good.
I am absolutely grateful. I have places to go, things to do, and people to see.
My name is Dr. Matt Ward. I practice ophthalmology at the Riverwoods Eye Center in Provo, Utah. I tell patients that this is essentially kind of resetting the cells that support the retina. So there's this pigment layer behind the photoreceptor cells, the rods and the cones that most people have heard of. And there's it's kind of the support team for those cells that has started to have problems due to this disease. And essentially what the therapy does is it rejuvenates the ability of those cells to heal themselves, and it improves whatever processes is needed to happen to prevent progression. That may be eliminating waste products more efficiently. It may be inducing proteins like heat shock proteins and allowing them to perform whatever cell-saving processes they do. But the large studies show that it indeed does, and that my personal experience verifies that.
My name is Bart Warner. I'm 69 years old. I have wet and dry macular degeneration. I had no idea what that was 3 or 4 years ago. Did a thorough examination of both eyes. 5 hours later, I got my first experience with a shot in my eye. I kept studying and networking around, and I found that there was a friend of mine that had heard about this treatment by a doctor in Riverside, California, that had been treating people with dry and wet macular for 20 years. So I got hold of him, made an appointment, got on a plane, and went down there and had my first laser treatment. To have to fly down every 90 days for this would be awkward and inconvenient. So I started asking around, thinking about what other ophthalmologist I could get to maybe learn how to do this treatment. And it was Matt Ward, and Dr. Matt Ward. And when I came down, I said, "Do you treat or see people that have dry or wet macular degeneration?" He said, "Absolutely." So what do you do for him? I said, "It kills me because there's nothing I can really do for him." And said, "What if there's a treatment that would do something for him? Would you be willing to look at it?" He said, "Yeah, he'd read some things." So I started sending him whatever information Dr. Luttrell could give me, and the information I'd read. And he didn't say no.
My name is Dr. Matt Ward. I practice ophthalmology at the Riverwoods Eye Center in Provo, Utah. I've been doing vision protection therapy in my clinic now for 2 years, and it's been really a wonderful experience to finally have something to offer my macular degeneration patients who are frankly desperate for something that's effective and proven to reduce their risk of progression in this terrible disease. My first introduction to macular degeneration was long before medical school. My grandfather had macular degeneration and lost most of his vision in his later years. And as a teenager, I remember seeing him struggle to read. He would listen to audiobooks. It also affected his mood. He had quite a bit of depression, and toward the end of his life, it was extremely difficult. I've seen this mirrored in my patients as I've become a physician and treated patients with macular degeneration, how it not only affects their functional abilities, affects their emotional and several other parts of their life as they face the prospect of going blind. I was first introduced to the use of modern retinal laser therapy for macular degeneration that's become known as vision protection therapy by a patient wanting someone to do this for him in Utah. I have experience with retinal lasers, actually a cornea specialist by training, so I do a wide variety of things other than retina in my day-to-day practice, but I was intrigued by this option and was skeptical, frankly. I discussed with several of my retina colleagues who had heard of the treatment but didn't have much experience with it. I also started reading a lot of the papers that have been published by Dr. Luttrell and others to find out what was behind this treatment, what was the evidence suggesting that it works, and ultimately went to Ventura and spent time with Dr. Luttrell, training with him and learning from him regarding how he treats his patients. I was very impressed by his 20 plus years of experience with micropulse technology, his approach, and his data, thousands of patients over many years, showing real-world clinical proof that this is an effective therapy to reduce risk for progression to wet macular degeneration. These experiences and my patients essentially demanding it motivated me to start vision protection therapy in my own clinic.
As far as the treatment that Dr. Ward and Dr. Luttrell does, there's no pain involved. They give you a numbing drop. They put this gel in your eye. They hold the eyelids, and they put this ocular lens on so they can see into the back of the eye. So they know where to give the laser treatment. takes about 2 minutes. Again, after you've had 1 or 2 of these, it's no big deal. I have both eyes treated every 90 days.
After starting laser therapy for macular degeneration in my clinic, I realized that really immediately it was pretty clear that this not only is a preventative procedure, but there is a percentage of patients that see better after vision protection therapy with the micropulse laser. I never tell patients that they're going to see better. I tell them this is not the point of the procedure. The purpose of the procedure is to prevent progression of macular degeneration. But I can tell you there's a clear benefit to vision in a population of patients. Even after my first day of using the laser, I had patients that I called afterwards that were saying, I'm seeing better. I'm actually seeing things I haven't seen in years. And it's not 20/20 vision, but it's enough that these patients who have suffered year after year watching their vision get worse, it's life-changing for them to all of a sudden have something that's actually improved their vision in some circumstances. I've had patients in tears at times telling me what a difference this has made in their lives. And not only noticing some vision improvement, but also just that the fact that they can trust that there's reduction in the chances of them going blind over their lifetime.
And I sleep a lot better at night knowing that I have a chance to have this thing help slow down this progression so that if I live another 20 or 30 years, I'll still be able to see.
My name is Dr. Matt Ward. I practice ophthalmology at the Riverwoods Eye Center in Provo, Utah. It's easy looking at something like this to be skeptical. It's easy to look at this treatment as on the fringe or maybe not something that others are doing. That's totally understandable. I think any significant change in medicine in general, there's a lot of resistance early on. My experience, just in the beginnings of this movement, is that this has the potential to change millions of lives. I mean, this is the single greatest cause of vision loss in the developed world, and our population is aging at a rate we've never seen before, and so there's huge need for this. I think as patients start to experience this, as doctors start to have their own experiences with this will be something that can become a worldwide movement toward preventative therapy for macular degeneration.
I'm Dr. Jeffrey K. Luttrell, a board-certified ophthalmologist and a fellowship-trained retina specialist. I'm the developer of vision protection therapy for age-related macular degeneration, or AMD. I'm also the founder of Vision Protection Institutes, dedicated to preventing vision loss from AMD. We're here to help you see all of your tomorrows.
Vision protection therapy is a unique proprietary treatment program designed to minimize the risks of visual loss from AMD. Vision protection therapy was developed by Jeffrey K. Luttrell, MD, pioneer of restorative and preventative treatment for retinal diseases. Internationally recognized as the world leader in his field, Dr. Luttrell is ranked in the top 5% of all scientific researchers worldwide by ResearchGate.net due to the importance of his innovative work and his development of SDM, the advanced laser technology underlying vision protection therapy. Vision protection therapy is informed by 2 decades of clinical experience, many peer-reviewed scientific publications, and over 200 U.S. and international patents. The Vision Protection Institutes were founded to bring the sight-saving benefits of vision protection therapy to everyone. No one else in the world has the knowledge, experience, and advanced technologies to help you prevent vision loss from macular degeneration like the Vision Protection Institutes.
We hope this information about AMD and vision protection has been helpful. Our mission at the Vision Protection Institutes is to help you continue to enjoy the best possible vision for the rest of your life, even if you have AMD. Nothing does this better or more safely than vision protection therapy. Please call or visit us online at visionprotection.com. We're ready to help you.
My name is Dr. Matt Ward. I practice ophthalmology at the Riverwoods Eye Center in Provo, Utah. I mean, every ophthalmologist has sat in the chair and they've felt the frustration and the pain of these patients. I mean, that's what it comes down to. I think that if you can only say to a patient so many times, there's nothing else we can do. And if you learn of this treatment and this therapy and you read about it, you actually learn that there is something we can do. And in my mind, where it's such a low risk treatment, I mean, there's so little downside to it, I frankly, I don't see how you can stand by and say, well, I'm not gonna at least explore this or offer it to my patient through someone that does do it. And so I think over time, doctors may decide that it's not something they want to do personally, but they should consider it as an option that there is real evidence that supports the use of micropulse laser to lower risk of macular degeneration progression. My name is Dr. Matt Ward. I practice ophthalmology at the Riverwoods Eye Center in Provo, Utah. Well, I think a lot of patients are apprehensive when they first hear about this treatment. I never push them to do this. It's something that I want them to read about, to become educated about. I consider this something that we decide to do together, and I think after their first treatment, a lot of that drops away because they can tell, oh yeah, this didn't hurt my eye, there was no pain involved, it was really simple, it was short, and so I think a lot of those initial apprehensions go away after they've had that first treatment. There's some mild discomfort associated with the lens that's put on the eye to magnify the doctor's view. There's some goopiness in the eye after the gel that we use for the lens and things, but there's really no pain, and patients after doing it, it's really reassuring that they come back. They want to do it again.